Okay, hey, welcome to this episode, the very first episode of Dr. Pod, your podcast with a real doctor, where we ask them questions and we get real answers from them. Today we have Dr. Casey with us.
Yeah.
Hello, Dr. Casey.
Hi,
it's a
hi.
pleasure to have you on our.
Thank you so much. Thank you.
So, yes.
Casey is a short form of Krishna Chaitanya. I'm a neurosurgeon. It's been 15 years into the practice now. So I've been practicing in Bengaluru for the past 15 years.
Awesome. So tell us a little bit about your interest, because when we first met you, you were talking about a little bit of about medicine and generally science in itself, and then you said something about.
I'm basically a physics enthusiast. From the beginning, I was a very avid reader of astronomy books and all that.
Okay.
So, but unfortunately, in the schooling and all that, what happened was the mathematical background behind science was not that, for maths you need to have that, the teacher should be good, as in he should create that curiosity and all that. But unfortunately, we had teachers who were very, the old school kind of a teachers so because of that, somewhere down the line, I lost the the mathematical part of the physics, but I just still was curious about physics in general. So then whenever I just went through the medical profession, but then since I love my physics, so I started using a lot of physics concepts in medicine and neurosurgery, and it's really helped me in understanding this applied science like biology and medicine in a better way than other people. I feel that way. Yeah. So.
Awesome. So we'll come to that, how he uses physics in medicine, because that's, to me, is very interesting, because generally when you look at people in the medical field, they're generally a bio enthusiasts. They're very good with biology, and then they go on to physiology and so on. But physics.
Yeah. Basically, my take on this is that basically physics is the most purest of the science, as in.
Okay.
Before physics, it's only mathematics, as in we use mathematics to understand nature, our universe around us.
Yeah.
And then chemistry is a second, child you can call, as in, first you have maths, then you study nature through mathematics, that becomes physics.
Yeah.
And then the physics at the most basic atomic level is chemistry. It is at the place where the electrons and all that, interact, that's chemistry. And chemistry, more complex chemistry, is biology. So biology is an applied science, according to me. It's not pure science. So whatever concepts which we have in physics and maths can be very well applied to biology. Unfortunately, are not being applied that well. Is my take on it.
That's a very, very interesting take. I mean, I've never thought of it that way, but it makes a lot of sense when you think about it that way. So tell us a little bit about your profession, your journey through med school.
I think I started my doing my MBBS from JIPMA, Pondicherry, in 1996. So that was the time when I joined JIPMA, and 2001, 2002 I cleared and finished MBBS.
Okay.
Then later on I continued doing MS General Surgery. That is in JIPMA itself. And in 2007 I went and did my MCH Neurosurgery in Jaipur. There's a college in Jaipur, it's Sawai Man Singh College. So that's where I finished. And 2010 I started practicing neurosurgery.
So you came from Jaipur?
Directly, since my wife is from Bangalore, so I had to come here. Otherwise, I am from Hyderabad, so my interest was to go to Hyderabad, but anyway.
I know Bangalore needs a lot of.
That's
awesome.
15 years I've been here now.
Okay, so your second year has been a long time ago, like 98, 97, 98 is probably what your second year of MBBS was then?
Second year, 97, 98.
Why we are coming to that is we have heard this term called second year syndrome. Okay. You aware of that? Have you heard it somewhere?
Maybe I'm a little old school, so I don't know much about that. So maybe it is a new one. So I don't know much about that. Yeah, tell me what is it?
Second year syndrome is typically where the med students, when they finish their first year and they start understanding, physiology in a much better way and stuff. In the second year, they come to the symptoms of, diseases and syndromes and whatnot we have. And they start evaluating themselves whether do I have these. So have you come
Yeah, it does happen because a lot of times when we start seeing a particular disease has this kind of symptoms,
Yeah.
and then even if you have a little of such symptoms, you start what you call fearing and getting anxious about that. It does
Yeah.
happen, yes. And now it's happening in general, I guess, because Google is there everywhere. So we all have a second year syndrome. Yeah.
Yes.
So
So that's the other thing, very interesting, because everybody today, how do you feel when somebody comes and tells you, doctor, why don't we do this surgery directly, just,
I mean, I do. Obviously, we need to. We are in a corporate field, so we can't directly, blatantly, shout at them. We could do that in general hospitals, but not in corporate. So we patiently hear them out, and then we obviously try to make sense and logic to them, saying that whatever you do, read and learn from Google, there's much more to that than just that.
Yeah.
So what I feel is, always in online, you only have half truths basically. So the full truth only comes when the particular person who is trained or who is professional in that particular thing will be able to give you the complete picture. So, but unfortunately, again, that also is clouded by a lot of other things around. So,
Yeah, and one of them is probably human curiosity also, because people are a lot anxious about things. But then this is a very important point. When it comes to medicine, Google is not your best friend. So if you go into if you have some issues, you go into Google, you start searching, and then straight away it jumps to something very, very serious, very critical, and then you go to the doctor and you figure out it wasn't all that serious to begin with. So that's
a lot of times it is like that. A lot of times.
Yeah. So, doctor, tell us something. You are a neurosurgeon. Before this, you trained yourself in general surgery, and before that, it was medicine in general. Why neurosurgery? Why did you pick neurosurgery?
So my as I told you, two interests in life was, one is physics, the other is obviously anything mysterious we like, right? So there was this mystery of trying to find out the basics of nature, as in the same time the fundamentals of how we think and what happens in our brain. So that's one thing I really wanted to learn and understand better. So since I didn't have that good mathematical background, and I went away from physics proper, then the next best option was for me to jump into the next, which I was always curious about, was brain. So that was the reason why I took brain. I was interested in even taking cardiac surgery and all that, but I think that curiosity led me to neurosurgery. But having said that, what we do in neurosurgery is completely different than the actual, because there's nothing, it's like a monotonous thing in the sense, though we all start off with this thing, but neurosurgery itself is a little bit different from the actual research which probably happens in neurosciences.
Right. Yeah. And the research field is definitely different. In fact, we happened to meet Dr. Rajan from IISc, who is a neuroscientist. Oh, you know him?
No, I heard about
him. Okay. So he was working on applying artificial intelligence into neuroscience in general.
So there is a entity which Elon Musk has been doing right now with Neuralink.
Yeah.
That's something called as a BCI, the brain-computer interfaces.
Okay.
So, but that research was going on a long time before what Elon Musk was doing. As in, this whole thing was there almost now 25-30 years. It's been there.
Okay.
This whole thing of BCIs, brain-computer interfaces, was tried a long time back as well, where the blind people are tried. They insert chips into their occipital cortex where the visual stimulus happens, visual processing happens, and then they were given a camera, but then that didn't work out that time. Again, people are starting to do research.
Yeah, because now the electronics have become much smaller now.
And processing speed has improved. So,
yeah, definitely.
But the one roadblock in all that is the way the brain behaves. So the brain, since it's an organic thing, anything inorganic, anything invasive, anything which is not not biological or not of the host, not of the host as in, like say if it is not mine, okay, so it will react to it, and eventually it forms a layer of inflammation, and it will wall it off. So this whole concept of BCIs, though, as I was telling you that I was interested in research in this field, neuroscience field, but once I started doing my neurosurgical practice, I understood that one very clearly. The brain, whenever it has a foreign material inserted inside it, it will behave the same way it has behaved forever, that it walls it off. So it doesn't interact with it. So okay, you may develop algorithms or good, very high processing speed microprocessors, but eventually the roadblock is that. The roadblock is how the brain reacts to the inorganic thing what we're going to use. So, I mean, having said that, always there is some difficulty in that. So maybe we don't know if they come out with something where they can improve.
But there's also the other field where we use artificial intelligence for non-invasive, methods to treat some brain disorders. So maybe.
Yeah, in that sense, definitely. But what I was talking about is the way directly you are interacting with the brain. Right. That particular thing has a definite roadblock. Okay. So yeah. So just like organs, when you are putting an organ into the body, what happens is there is a HLA compatibility, as in the molecular structure of the cells. There has to be a compatibility, otherwise the body rejects the organ. Similar to that, anything else, same way. So
that brings me a question. So when you say that there is you check for compatibility and everything, and despite that you have to give immunosuppressants, for example.
Yes. So why you give immunosuppressants is to reduce that problem of incompatibility. Okay. So to reduce the incompatibility, we give steroids and give other immunosuppressants to make it as seamless as possible. Otherwise, no matter how well matched they are, still there will be, body will mount an immune response to it. That's the reason why we have to give immune suppressants for that.
So if you had to tell us one of the most interesting brain surgeries you've done in the last, say, 3 years, what would that be?
Any brain surgery which tests your focus and your ability to sit for a long time and focus on at least 10-12 hours of surgery if you do. So a lot of surgeries are that we do such surgeries, like especially deep-seated brain tumors, or sometimes you do surgeries for abnormal vascular network, like the blood vessels in the brain are not normal, and so it's called an AVM, arteriovenous malformation. So those surgeries are challenging, and that really requires your complete attention and focus. So I really enjoy doing such surgeries, though it's pretty, as I said, scary, as in we all are humans, so we do feel afraid and apprehensive when you start off the procedure. But when you start doing everything the way it has to be done, then slowly we conquer the tumor or conquer that.
So you mean to say you have usually you have a very specific set of protocols which you follow to get to a surgery, so that there are less variables over there.
Yeah, definitely. So the most important variable in brain surgery is first, and not just brain surgery, in general medical treatment, is primum non nocere. That's a Latin term. Okay. Primum non nocere means first do no harm. So that is our first protocol, as in whatever you do, any kind of a treatment, medical or surgical, the patient shouldn't be worse than what he was before. Okay, so always we balance our treatment modality or surgical modality based on that. So at any point of time we feel that we are going to the level where the patient is getting harmed, we stop the procedure then and there. And then obviously, because that's what we want. See, eventually you're doing a procedure to improve the person's lifestyle or whatever. So I think that's the thing. And having said that, we do follow a lot of stringent protocols from the time we admit the patient till the time we actually start operating. We do have a checklist, okay, and then even during the procedure also, we do follow some checklist. But the thing is, apart from the checklist as well, there should be, the surgeon or the person who's doing the procedure should have his own way of tackling problems and anticipating problems. So most important thing for us is that. So we need to anticipate a problem, just like in chess what we do. No? So we anticipate, if I do this particular step, what can go wrong in a couple of minutes. Okay. So anticipating a problem will help us in trying not to get to that level of actual harming the patient.
Right. So you try to anticipate what could go wrong, and you make changes to
my present strategy.
So that you're reducing the risk.
And giving more benefit to the patient.
Right. And I also heard that in hospitals you have this review. So after every surgery, you have a review on what went wrong, what could have been done better, what went well.
So, in fact, it's a routine among us in our team where when we do a surgery, it could be a simple surgery as in a more complex surgery, whatever. Even if we have done it to the best of our ability, as in the patient has satisfactory results, we still kind of casually discuss when we are having a tea or a coffee or whatever, that what else you could have done better, so that we can give him a better, outcomes.
Right.
So this our analysis, rechecking, and this has always helped us to do better work. I think everybody should do that in that way.
Awesome. So that's actually to say that if you're going to a hospital where you have experienced surgeons, you have teams, they're generally pretty organized in that they have very specific sets of protocols. You have a large number of people, at least a few very experienced people thinking about what is next. They always calculate not just the next step, but the step after and the step after, so that your risk is absolutely minimized. So when you are going into a hospital for a surgery for yourself, maybe for a loved one, for anybody, this is something that you can take home. That there in the medical field there are a specific set of protocols which are designed in such a way that you don't walk out worse than you walked into the hospital.
True, very true.
Okay, and before we wind up, we want to know how you apply physics to medicine.
Yeah. So, like for example, in brain, and there is blood flowing around. So I'll give you a small example of, say, the aneurysm formation. In the sense, aneurysm is an abnormality of a blood vessel where it just, the blood vessel becomes thinned out and it bulges out. Okay. Yeah. So that is again depends on fluid dynamics finally. So fluid dynamics, as in blood has to flow through the tubes, and then there is something called as a linear flow, laminar flow, and then there is a flow where it is non-laminar. It becomes turbulent flow.
Yes.
So turbulent flow is something where chaos theory kicks in basically. So wherever it turns around, wherever if the blood vessel is not smooth inside, if it is having some ulcers or some blockages, so what happens? The blood flow becomes turbulent. So as there is turbulence, the eddy currents gets. So because the eddy current, so usually in a laminar flow, what happens is the center part of the fluid has a maximum velocity, and the flow which is adjacent to the the walls are slow.
Yeah.
So that's the reason why the injury to the walls will be less. Okay. But when in turbulence, what happens is, because eddy currents, the flow, the pressure head is evenly distributed all along the fluid, across the walls, in the center as well.
Yeah.
So because of that, there is more tendency of the wall becoming thin or weakened because of turbulence. So turbulence happens wherever the artery bends. Whenever there is a bend, or whenever there is a injury in the vessel, like an atherosclerosis we talk about, right? Like you have the strokes or we have this heart attacks. All these happen because of an injury in the blood vessel.
Yeah.
So all these areas there is turbulence happening in the blood flow that causes more injury, and it can either cause an aneurysm or it can again cause a clot formation inside. So either way it causes stroke. So this is how some of physics, a little bit of physics into the but the thing is, so if you get to know more and understand it more fundamentally, you can plan your treatments in a better way. That's the reason why I
pretty interesting. Okay, so
know that why does aneurysm happen, or why does turbulence cause more of that kind of a defects, or it causes clots. So now we know.
yes.
Okay, so that's how it is.
Awesome.
Much more to that?
Of course, I mean there is obviously you just gave us one example of the large body of physics that also governs all this. So that's great. If you had to give one tip for this episode for our audience, anything, it could be anything. It could be about just learning something, or it could be about brain surgery. It could be about general. What would that be?
I guess. One thing which I've obviously, the thing I've learned in my life, initially I was not so accepting if there is a problem with me or a thing which I need to correct and all that. So I probably, though I was a little in the sense, I used to get it in the sense, we need to understand that there is, if something happens, any particular situation happens, how much of a contribution is yours in that? In the sense, if a situation is wrong or right, either way, so you should have that ability to accept that there is a flaw in you which can be corrected. So because a lot of times in our prevailing sense of ego that okay, I can never go wrong, we tend to ignore. See, the first step is acceptance. Accepting that there's a problem, and in that problem how much your contribution is. If you're able to clearly identify, then I think that's the first step to success in any level, in any field. So I think that's my take, and that's the reason why we all have a what we call constant. As I told you before, after every procedure, what we do, surgery we do, we always talk what could have been done better, and always with my colleagues, I always interact and I said, was I doing something which I was not supposed to be doing? So I think this kind of openness is not there when as you go in your seniority, you start developing some kind of I don't know what it can be called, arrogance or an ego, which you tend to not take in criticism, not take in. I think that's something which we need to. We all need because we all need to. If we have that interest to grow and progress further in our endeavors, I think that's the most important thing to have.
And especially in your field where the person who's going to be impacted is a patient who's already suffering.
I guess it's, again, I told you in general, it's the customer who will suffer.
Completely. Definitely. No, I completely agree. Now I was just saying from the medical standpoint it is, and for us, I'm a tech engineer, for example. So if I make a mistake, for instance, my entire platform goes down, my entire company's business is...
Correct. And so if say SpaceX is one engineer says that, no, this is the way you should put in fuel into the rocket. There may be 100 other ways, better ways of doing it. If that guy just bypasses it and says, Falcon 9 again smash into the ocean. So that's, I guess, that's where technology or things improve when you have a healthy discussion. I think that's something which is missing in medical field.
I mean, I would say it's generally missing. I mean, how many times have you been on the road and somebody hits you and then they try their best not to take the blame on themselves, right? So it's with all of us. I think
it's a honest thing for us. I think we should all delve inside and see that okay, this has to change.
Definitely. Basically. So instead of bringing up all the walls and the guards and everything up, it's probably important that we listen to people.
Because I think the future is collaborative. It's not, only there's no one person standing.
No lone wolves.
Yeah, it's all collaborative. So I guess we need to understand that.
All right, that was great. Thank you, Dr. Casey, for being with us here today. It was a pleasure having you, and we hope to have more episodes soon like this. Thank you for tuning in. This was the very first episode. There could have been a lot of things could have gone wrong right now. If they have, please make sure you put them in the comments below. Let us know how we could have done it better, and we'll try our best
and get better next time.
Yeah, get better next time. Thank you for joining, and have a good one.